Hi, everyone. I'm Joe Easton. So while you are taking a look at that poll and answering it, hopefully, let's talk about who's on our panel today. Dr. Jeanne Lambrew is a name you are likely familiar with as head of the Maine Department of Health and Human Services. Commissioner Lambrew leads the largest agency in state government, which provides healthcare and social services to approximately a third of the state's population. Commissioner Lambrew is joined by two experts with very different kinds of experience working on behalf of Mainers who need health care and health insurance to pay for that care. Patty Lovell is the lead navigator for the Western Maine Community Action Healthcare Navigator Consortium. I had to practice that one, which provides enrollment assistance, education, and outreach. The WMCA Consortium holds the contract with the state of Maine, DHHS, and subcontracts with 8 nonprofit agencies throughout the state to support individuals in their communities. Kate Ende is the policy director at Consumers for Affordable Healthcare, a nonpartisan, nonprofit organization that advocates for the right to quality, affordable healthcare for every person in Maine. Kate provides policy research and analysis and directs the organization's legislative and administrative advocacy, largely focused in the areas of Medicaid, private health insurance, and state and federal healthcare reform. We are also joined tonight by Bill Barassa from Harvard Pilgrim Healthcare, tonight's sponsor. Bill is going to kick us off with a few words, and he'll have the first question for Commissioner Lambrew.
Thank you, Joe, and good evening to all of you. It's certainly a pleasure to be here this evening. And I first want to wish everyone a happy and safe Thanksgiving coming up. Thanksgiving week, hard to believe, end of November. It's still fairly warm out, right? So I'm only wearing a sweater this evening. I have joined a number of these BDN virtual events since the pandemic began and have always found them all the topics quite engaging. Tonight, recognizing this topic, Commissioner Jeanne Lambrew's presence, and that Harvard Pilgrim Healthcare is one of the insurers offering coverage here in the state-based exchange. It was a conversation we wish to be part of. So thank you for having me. I am going to turn things over now to Commissioner Lambrew. Commissioner, I have a comment and a question for you. A comment for what must have been a monumental effort to get this exchange up and running by November 1st. I want to offer my congratulations to you and your team. No doubt it took a considerable amount of time and effort, as I mentioned. My question, could you give us an overview on why Maine chose to offer its own health insurance marketplace called CoverME.gov, as opposed to allowing Mainers to continue to apply through Healthcare.gov?
Sure, and I would just like to start by thanking you, Harvard Pilgrim, for sponsoring this, and the Bangor Daily News for having this type of forum that allows people who are out there, subscribers, the general public, to be able to answer questions or ask questions, because we think it's crucial for us to be able to directly provide information to people who may need it. But to start out with, why did we change? To back up a little bit, a health insurance marketplace is a source of information, enrollment opportunities, as well as consumer assistance for people who are buying health insurance on their own. Since 2014, Maine has chosen to use the federally run health insurance marketplace called Healthcare.gov rather than operating its own. But now the state of Maine decided to launch its own marketplace called CoverME.gov. There are several reasons why we did this year. Number one is that we can better design the experience for consumers by developing a plan compare that has Maine specific input. We have more opportunities to enroll people because we can set the rules. So for example, there'll be an extra month this year for open enrollment. You can sign up until January 15th. Last year it was December 15th. We also offer special enrollment periods during the year next year that are different than what the federal government offered. We also know our residents. We know who's uninsured and why. So rather than having one general marketing campaign that some of you may be seeing for healthcare.gov, which is great, we can go one step deeper. So for example, if you're in the Portland area, you'll begin to see CoverMe.gov signs on bus stops. We are now doing placemats that are going to be available in diners across Maine. We have 80 gas stations across the state that will also be putting up information, as well as working with community partners who can begin to address those barriers to coverage. So in short, we're doing this because we think the consumer experience will be better for Maine residents. We can really control the ways that people come into the system. And we think we know our residents best and can use those same dollars that have been going to the federal government here in Maine to do better by Maine people to ensure that they have affordable health insurance coverage.
Thank you, Commissioner. We've closed the poll, and so far it looks like about a little more than 60% of the people who are here tonight had insurance through healthcare.gov last year. So we're speaking to a group of people that is mostly making a move from one system to the next system. So just sort of keep that in the back of your head while we're having the conversation. And no one said that they are using MaineCare, Medicaid, or Medicare. So that's just sort of some context. And about a third of the people said that they had insurance in 2021 through an employer. So that's just some background. So in terms of change, like you talked about being able to provide that extra month and a special enrollment period and being able to design a system that is specifically, designed for Mainers and using those funds in state in an appropriate way for Maine residents. I'm curious if you can if you can talk for a moment specifically about the plans available in terms of change, right? What has stayed the same in terms of those plans available here and what has changed?
Sure. So I think it's important just to begin with what hasn't changed, because I do think it's really important for all consumers to remember that we still, for example, have the same 3 insurance companies, Harvard Pilgrim, Community Health Options, and Anthem, that are offering plans through the marketplace. There are about 71 of those specific plans that are available this year. Those plans have the same high quality that they had previously, offering essential health benefits, some of the preventive services that people really value, and financial assistance for those people who need it. What is different is that we do have more financial assistance available this year thanks to the American Rescue Plan. That means that if you previously came in and tried to get affordable coverage, found it wasn't affordable, come back, because the financial assistance has increased this year nationwide as well as in Maine. The ability to tailor that search for plans is also different. We are using an award-winning website to really try to figure out how do we give consumers the information that they need to be able to make a plan choice. Again, as I mentioned earlier, there'll be different opportunities for those people to be able to sign up for a plan. We also know that the call center that we're using this year has been trained by Maine. People like Patty Lovell, who you'll hear about, and Kate Ende, who's also on this call, have additional support from the state of Maine because we're running it on our own. So we hope that the ability to get information for Maine residents is improved this year.
Thank you. It's interesting. You mentioned having a call center with people in Maine staffing that call center. We've also found that to be so important here, having local folks answering the phones, because people on the other end want to know that people know their community. That really matters. So I want to turn a little bit to that plan compare tool, which really is this like central piece of like how people experience the system, and turn to Patty. So when we put out a survey asking what questions BDN readers had about the new marketplace, one of the most common questions we received was about that new plan compare tool. Can you take a few minutes and walk us through the tool and talk about what information people should have on hand when they start comparing plans, and maybe even show us what that tool looks like so that we can demystify some of it and get familiar?
Sure. Thank you for having me here tonight, and let me share my screen so we can go over the compare tool. So this is what you're going to see when you log in. And so you go to get started, compare plans. And so click this and put in your zip code. and then you put in your age, and I'll be honest. And I'm not pregnant, I don't use tobacco, I'm not Native American, I'm not offered coverage through an employer, Medicare, Maine Care, or the military, and I am seeking coverage. If I wanted to add a spouse, I would add this. And so I could put in, but they're not seeking coverage because they have Medicare. And you don't need to add these, but you can if you think your health is good and you're not planning any procedures. And then you hit next step. So you would put in your income, which you estimate for 2022. So this is the household income between you and your spouse or just you. So I'm going to put in 75,000. And that's going to give me an estimate of $298 for federal assistance, financial assistance. But I'm going to change that because I want to show some of the cost sharing as well. So that changed it to $730.23 for the month. And I can put in my provider, a local provider here in Farmington. And then we have Franklin Memorial Hospital. And no medications, so we're going to keep browsing. And this looks confusing, but it's really kind of a cool device. Part of this is it's going to give you a price comparison between a good year, a balanced year, and a hospital stay. So you're going to compare plans. And so from here, you can see that this is a bronze plan. It's got a monthly premium. With my subsidy, it's going to be $1.92. It's got an annual deductible of $6,250 with an out-of-pocket maximum of $7,000. And by hovering over, you can see that Dr. Bean is a tier 2, but Frank Memorial is a preferred network. Another cool option is if you click more information, it's going to give you a quick rundown of some of the things that's available. You can always go to view plan details, and this will, you'll be able to scroll, see what the individual, family deductible, maximum out of pocket, and then the estimated cost for a good year, a balanced year, and an estimated cost for a bad year. And then you can go down, click on drop downs, and it will talk about the cost of your primary care visits, hospitalizations, and then other services is another great place to look. So for allergy testing, it would be 50% coinsurance after deductible, which means I need to meet that $6,250 deductible, and then they would pay 50%, but there's no charge after deductible on the tier 2. So there's lots of different things in this one. And if we go back to results. And again, you've got the good year, the balanced year, and the bad year. And what these three means is this is a good year.
I'm glad you're going into that.
Okay, so do you want me to just keep going?
Well, no, I think that was one of the things I wanted to ask you about, which is, we always hope to have a good year. And every time you have, or most of the time, if you have a bad year, you thought you were going to have a good year. So, I mean, is this kind of just getting a case of a sense of like best case, worst case?
It is. It really is, because this is a good year. This is, you've done your wellness check, everything's good, but then you have the example they use is you have a sniffles and they determine that you need a round of antibiotics. And so it's just like a short-term prescription and a couple of visits. And this also includes the cost of the premiums. So this is a good year. If I'm healthy, it would be $725. A balanced year is based on my age and based on kind of an average expense for people of my age.
Mhm.
And then a bad year is hospitalization, surgery. So
And are
if
these
you,
are these costs also reflecting the financial assistance that that we looked at the very beginning, or is that not factored in here?
this is factored in. So if you continue down, and most of these are going to be the same because of the monthly premiums. So, but this one is a little bit different. The premium's gone up, but also the deductible and the out-of-pocket maximum are the same. So you're going to have to meet that 8,700 in order for the plan to begin. It's got a $50 copay for providers, no charge after deductible for urgent care, preferred drugs, no charge after deductible, which means you need to meet that deductible. But a specialist is $100 copay and generic drugs is $25. And so that would just be comparing. I make people dizzy. I scroll through and I apologize in advance for that.
So I'm wondering, and I don't know if this is the right question, if this is for you, Patty, or if this would go to Commissioner Lambrew, but I'm curious about that regular enrollment process and the special enrollment process. I realize we're zooming out a little bit here because the going into the nitty gritty is super important, but I want to make sure we don't miss those things that make this period of time important for folks who are really trying to figure out what do I have to do next, right? So I want to know about what the difference is between the regular enrollment process and the special enrollment process, and how do you know which enrollment process applies to you?
So for right now is the open enrollment, and anyone who qualifies for the CoverME.gov insurance, so they don't have insurance through their employer, they're not on Medicare and they're not on Maine Care, and they couldn't get coverage through their spouse's employer sponsored healthcare, would qualify for CoverME.gov, and then they could sign up now through, again, January 15th. If they want it to start on June 1st, they need to sign up by December 15th. For a special enrollment period.
I want to back you up. You said if they want to be covered by June 1st, did you mean January?
I mean, January.
Oh, excellent.
January. Sorry about that. I'm already into summer. These rainy days are just brutal. So if they want to be covered by January 1st, they need to make sure that they're signed up by December 15th. But again, Maine has expanded the open enrollment until January 15th, because unfortunately, I frequently got calls on like January 3rd. So I've decided to be healthy this year and I think I need health insurance. And those would be really difficult conversations to say, without a qualifying special enrollment period, you cannot sign up outside of open enrollment. So that kind of segues into special enrollment periods.
So if someone signs up on January 14th,
Yep.
after having a couple of weeks into the year, is that retroactive to the beginning of January?
No, so that's why it would go to February 1st.
Okay.
That's why if you want it to start January 1st, you need to sign up by December 15th. But if you sign up on January 14th, it would go to February 1st. So you would still have coverage for 11 out of 12 months.
Yeah. So I'm looking at the clock. I could dive in here so deep, but I think we probably should jump out of the pool for a minute. And I want to turn to Kate. If someone has never purchased health insurance through a marketplace before, what do they need to know about going in here for the first time? Or what do they need to be prepared for? Is it different from buying health insurance in another avenue?
Buying it through the marketplace, one of the the best things about that is that it allows you to not just purchase a plan, but also to apply for financial assistance to help lower those premiums, and for some people, lower deductibles and cost sharing as well. And so, the application will ask questions about, your household income, if you have other coverage available to you, because it's screening you not just to be able to purchase a plan full price, but for that financial assistance as well. And I did see some questions in the chat around, what income counts. And the answer is it's for most people, it's going to be your gross taxable income. There are some exceptions, for example, non-taxable Social Security, you would include that. But for most people, it's their just a gross income. But I think that for somebody that's new to this, what I would do is I'd recommend that they contact a Maine enrollment assister throughout the state, so you can get free, confidential, non-impartial assistance, not just walking through the process, but also understanding your plan options. And so you can do that. CoverME.gov has a list of local assisters if you type in your zip code. We also have a helpline, and I know Patty's has a statewide navigator line as well. And so there's a lot of resources out there to help people walk through the process.
I had to take myself off mute there. Now, what about if somebody has already purchased in the past through healthcare.gov? So they're familiar with an ACA marketplace, and they live in Maine, they want to move over to CoverME.gov for this year. Does any of their information that they put into healthcare.gov in the past transfer over into the new system? Would there be any auto enrollment?
Yes, so it absolutely does. So their information does get transferred over. In order to access that information through CoverME.gov, they do need to create a new login, so new username and password essentially. And if there's multiple people in the household, it's important that whoever was the lead applicant on healthcare.gov is the same person who sets up the CoverME.gov account. And if so, then all of that information should get pulled over.
That seems like really important information.
Absolutely. And, for most folks, if they had a marketplace coverage, if they don't take any action, auto renewals will work in the same way as previous years, where, you'd be auto renewed into either the same plan, or if that plan is no longer being offered, the most similar plan. But with that said, there's, as Commissioner Lambrew talked about, more financial assistance this year. There's a lot of new plans this year. So we really would encourage people to, take a look at their plan options and actively make that selection.
So I want to double click on that thing that you said about, it was just so specific that, like, if you want to have your information from healthcare.gov move over to CoverMe, that you have to have the same person from your household who did it last year do it again this year. And that brings me to a question for Commissioner Lambrew. So Commissioner, in a recent interview with Maine Public, you mentioned learning lessons from the 2014 launch of healthcare.gov. And so my ear perked up when Kate mentioned that, because I'm wondering about what were some of those lessons and how have they helped in the process of launching the new service? What specific things did you learn from that experience?
Sure. And I do want to just clarify one point that you just made. So if you want to come in and update your account, change your family size, if something has happened in the last year, that's where what Kate said is right. You need to make sure that the same person who was in there last year comes in and does that. But again, if you were in healthcare.gov last year, you will automatically be enrolled in CoverME.gov. That's just a straight period. But to go back to lessons learned, I mean, I think healthcare.gov works well now. It didn't work quite so well in 2013 as we were heading into our first open enrollment period. So we had a whole lot of work to make sure that we had a team in place to try to make the technical fixes as needed, and the consumer assistance there by our side to help those consumers who are struggling. Any change requires some transitions. There are going to be kinks in the process. We're experiencing some of those now. All that said, we really want to make sure that people just recognize that we're in the early days, that on the whole, things have gone smoothly, And we are responding to issues as they come along. So if people do have questions, are struggling with either the website or understanding something, they should let our call center know, and we'll get right on it.
Can you say anything about what some of those hiccups have been, or is that not something that you want to talk about?
Yeah, they're all very like individual specific about, again, somebody certain types of circumstance that we just need to work all our way through it. We do our best to try to anticipate everything, but you can't anticipate everything, but we are working our way through it. There's been nothing major that has been blocking people from getting coverage through CoverME.gov.
That's great to hear. So I'm kind of thinking that now might be a good time, especially since I'm seeing a lot of questions come in through the chat, to pass the baton over to Matt Yunker from the opinion team, who can navigate us through some of these questions from people in the room.
Hi, everyone. Well, I think Kate managed to knock out a couple of them at once in one of her answers. But someone else is wondering, they're saying they have a private plan through Anthem Blue Cross. They've had it for the past 3 years, and they're wondering, are they still going to offer that as a private plan and not on the marketplace? So I guess there's a specific question there, but also maybe a larger question is, how is this change affecting private plans, if at all? And I'm guessing that's probably first best lobbed at the commission.
Sure. I think everybody should check in with their own insurance company to make sure that their arrangement is set. So I think I would encourage that watcher or the viewer to really check in with Anthem. I'll just say generally though, the answer is no. We really have not made any major changes to the individual health insurance marketplace in Maine. We've changed the website, the call center, and some of the ways we're engaging with the consumers this year. But the same 3 insurance companies that were offering in the health insurance marketplace before are offering plans now. There are some more plans, and some of those plan features have changed. So for example, this year, for the first time, we're offering what's called Clear Choice Plan Design. We recognize that a lot of people get confused by every plan having a little bit different deductible or copay or co-insurance. So thanks to the Made for Maine Coverage Act that Governor Mills signed into law about a year and a half ago, we've now created these clear plan choices that offer these standardized set of copays and deductibles to make it easier for people to shop based on, is there provider coverage, is there covered, is there drug covered, what is the premium versus what is that little copay for that particular prescription. So we're hoping that the experience is simpler. But bottom line is, insurance companies in Maine are still here. There's been no change in that. And so for the most part, we're offering more choices and clearer choices than we did last year.
Okay. Actually, Commissioner, while I still have you, wondering, and I'm hoping this is a simple answer. This is from our pre-survey. Folks were wondering, what are the penalties if they don't have health insurance?
Yeah, so the Affordable Care Act, as originally drafted and implemented, did have an individual responsibility requirement that tried to ensure that people did sign up during open enrollment and stay insured, because we know that when people are uninsured and they go, for example, and use a hospital, the cost of the hospitalization is often passed along to everybody else. That said, in the previous administration, the tax penalty associated with not being uninsured was repealed. So there is no penalty at this time for being uninsured.
Okay, thank you. Marlene is wondering, if you are able to get health insurance through your employer, are you able to enroll in this marketplace instead of your employer's plan? And again, Commissioner, I think you could handle that one, but Patty, if you wanted to jump in from a navigator's perspective.
I'm going to do the short answer, and then Patty maybe can do the more complicated one. The short answer is yes, people can buy insurance on their own through CoverME.gov. However, if they're interested in qualifying for financial assistance, that is limited to people who lack affordable health insurance. But Patty, do you want to be more detailed on that one?
I was going to say a similar thing. If they're offered health insurance through their employer, we would work with them to determine if it qualifies for minimal essential coverage. If it does not, then they would qualify for coverage through CoverME.gov, but we would need to review the paperwork with them. Another thing is if it's considered affordable. So if it costs more than 9.61% of their income, then it would be considered, for their household income, it would be considered unaffordable. But again, a navigator can work with them in regards to going over these and determining that.
And Patty, while I have you off mute, Kathy is wondering about insurance options for someone who's a shared living provider dealing with a non-taxable stipend. And she's wondering how someone in that situation would get insurance.
So if the income that she has is not taxable, because this is reconciled through the tax return. So if there's no tax return or this income is not taxable and she has no other source of income from what I'm reading in her comments, then she may qualify for Maine Care if that's not a taxable income. And it's something we can certainly support her with reviewing.
Okay, thank you. And again, while I have you, how is the Navigator process different, if at all, from the Healthcare.gov navigation process? And what kind of Navigator resources are out there that people should be aware of and know that are available as they're working to understand this new system?
So the new system has also changed our title in that we are now the Maine Enrollment Assisters, but because we've WMCA has received the federal grant since the beginning of this in 2013 was the first year WMCA received the grant and helped people begin enrolling. And we were called navigators at that time. And because we've always referred to ourselves as navigators, we're going to have to learn new language. So an MEA is the same as all the others, but we are, because we subcontract with 8 other agencies throughout the state of Maine, we can actually refer to someone up in Aroostook County. We can refer to someone down in York County. It's kind of a unique situation. And we also support through referrals throughout the state. So I'm handling a lot of phone calls from the Oxford County area because I have a volunteer who is on vacation for the next couple of weeks. And through Zoom, we can do so many remote applications and work with people in that sense. So a navigator is just someone who's gone through some additional training, but we also are required to offer language options. So if someone's coming in with a needs an interpreter, we are required to offer that. And we also help with the appeal process. If someone something has happened, and we can support them with appealing a decision that has been made.
And so is your organization the main statewide resource on this front moving forward?
Yes and no. Yes, we are a resource. We are throughout the state of Maine. Again, we subcontract with 8 other nonprofit agencies throughout the state. And in fact, Kate and Cake work with us as one of our subgrantees, and they're an absolute treasure and benefit to the Navigator team because of their expertise in this field. So they are a definite complement to the consortium, as well as, like I said, we're from York County to Aroostook County, and we can provide referral assistance to people throughout.
Okay, thank you. Deb has asked, she's wondering how to find an MEA, and I got to be honest, maybe my brain's just not working at 6:37, but I'm not quite sure what Deb means by MEA. Maybe some of our
So an
panelists
MEA is a Maine Enrollment Assister, and it's what the person is that will work with you on completing an application, reviewing plans. We don't pick plans for you, but we'll help review the definitions, what to look for in a plan, making sure that it meets your needs. And so that if you go on to CoverME.gov and look under local help, you'll find a list of MEAs or Maine Enrollment Assisters.
Okay, Commissioner, it looked like you maybe wanted to jump in there, or
I was going to add the same thing. We have CoverME.gov/local help. And you can also call 866-636-0355. Again, if you need a language other than English, you can dial option 4. And in addition to these Maine enrollment assisters, we also work with agents and brokers, health insurance brokers through this system, because that's the way that some people in Maine have gotten their health insurance. So those options are also available on our website. Thank you.
okay. Another question that came up several times in the survey ahead of the event, a bunch of people were wondering where they're covered. Are they covered just in Maine, or does their coverage extend outside of the state? So again, Commissioner, maybe that's one for you.
Yeah, and since Patty has the plan compare nearby, I think in our plan compare document, you can look at providers and where your providers are, and I think you can get some sense of the network adequacy. I don't know, Patty, do you want to speak to that?
Sure, and I can also, did you want me to share that again?
I think that would be a great idea, because that way people
Sure.
can really see where you can find the information. Thank you.
So I know on some of them they had, I was thinking there was a thing over to the side that indicated if it was, I know that Community Health Options has some that are outside. And this one is not showing the coverage outside.
Look, Patty, while you're looking for that, I'll just add that we are looking at options for improving tools that consumers can have, and I know that this has been on our list about how do we give people a sense of, the number of providers, the types of providers that are available in the plan in their local area and nationwide. So it's a tool that we are definitely working on, even if it's not, even if we can't find it on this exact screen. So, and there's somebody.
I know that there was, I know that, like I said, Community Health Options had indicated that they had one that worked throughout the nation, and that there are several that work throughout New England. And because I've had a couple people that have gone on to the Harvard Pilgrim plan that have providers in Boston.
I believe Harvard Pilgrim also has some coverage in the New England states as well. And
right.
I think what's important is that if you are regularly seeing a provider that's out of state, you can, enter that either, through the CoverME.gov plan compare tool, or go to the sites directly and look at their provider networks. And so just to make sure that whichever provider or hospital that you want to make sure is covered, we'd recommend searching for that specifically. And also, Maine has passed consumer protections where if you are traveling out of state and you have an emergency, you have an accident, something happens, you can get coverage out of state, even if it's from an out-of-network provider. And the same thing goes for if there's a certain specialist that might not be available in the state of Maine that you need to see. And in that situation, you would, have to get prior approval, but there's a process in place, regardless of what plan you have, that you're able to access the type of specialist that you would need to.
Yeah, Kate, Susan in the chat has said she assumes emergency coverage is nationwide with all carriers. Is that a safe assumption?
Exactly. So emergency coverage, urgent care. So regardless of where you're traveling in the country, you should be covered during the emergency. I will say that sometimes emergencies can, depending on the situation, if you have a lengthened hospital stay where at some point during that you may have been, stable, where you could have transferred back in network, in which case it can get a little fuzzy, but more or less, essentially, emergency coverage is available regardless of which plan you're choosing through CoverME.gov.
Okay, thanks again. Commissioner Jeanne has just said something in the chat. She did find where they said National New England, and it was when choosing after she did her application. If that's the case, is there any chance that could be one of the minor kinks you were talking about in terms of what part in the process that information might be showing up?
So I do think if our provider lookup tool generally is as good as the input that we get from our different insurance carriers. So you should be able to, before you pick a plan, figure out if your particular hospital or doctor is covered by that plan that is not part of those kinks. We do want to add more tools like, percent of providers in an area that would be covered. That was one that we hoped to do this year, but we pulled off at the carrier's request because the information wasn't as complete as they would like. That's something we'll add in future years. But again, Kate said this as well. You should be able to find out before you sign up for a plan whether or not your providers are covered by that plan.
Okay. And Commissioner, again, while I have you, recently you had talked to Maine Public about, and you mentioned lessons learned from the launch of Healthcare.gov a couple of years ago, now almost a decade ago. And so I'm wondering if you could maybe here talk about some of those lessons that were already learned ahead of time years ago that the state's been able to apply to this launch.
Sure. So one of the features that is exciting going into this open enrollment period is that we've learned to listen. We really have listened to what Maine people want. We've gotten their feedback on what our website looks like. We really have worked with people like Patty and Kate and the many people, agents, brokers, other people who have helped Maine consumers over the years to try to take what they've said into account as we've gone to launch this effort. So we're hoping that our ability to talk to Maine residents and give them the kind of help that they need to sign up will be better. We also, on the technical front, tested and retested our website. Our website worked on November 1. It has been working ever since, and we again will continue to improve its performance throughout open enrollment. But again, it's been largely going well. And if consumers have problems, they should call our call center and let us know exactly where those problems are, so we can try to help them work it through. And I do think that we do know that coverage matters. I mean, going back to the rollout of Healthcare.gov, as hard as it was in the fall of 2013, by the end of open enrollment in 2014, over 8 million people in America had gotten health insurance coverage, and that's because they needed it. We know, especially during this pandemic, that health insurance matters. People with COVID-19 are often in the hospital for a long period of time. Long COVID has symptoms and challenges that could go on for a period of time, to say nothing of delayed healthcare that people are now needing, or the secondary impact of COVID-19, such as the impact on mental health and substance use disorders. So for all those COVID-related reasons, people need health insurance, to say nothing of, we're all one accident or illness away from losing our retirement savings or not being able to send one of our kids to college. So we do want to always remind people, and this is something we learned back in 2014 with Healthcare.gov, we know now more than ever that coverage does matter. So that'll be something you'll be hearing from all of us during this open enrollment period.
If I could pull a little bit from what you said there, How much did the pandemic experience and now this ability to create your own rules and for the state to have its own special enrollment period or periods, how much did that factor into this decision and the experience we've had these past year and a half, 2 years?
Yeah, so we did make this decision to go down the path of running our own marketplace before well, just as the pandemic was hitting. So Governor Mills worked on a bipartisan basis with the Maine State Legislature on this Made for Maine Health Coverage Act that included, among other provisions, launching down the path of, creating your own state-based marketplace. That's after pre-pandemic, the governor on day one expanded Medicaid or Maine Care. We now have over 85,000 people covered in Maine Care. Made for Maine began this pathway. So last year during the pandemic, we started doing our own consumer outreach and assistance using Healthcare.gov. And we made the choice during the pandemic to continue this work because it's just so important for the residents of Maine that we do our own consumer engagement on the health insurance marketplace. So that all began before the pandemic, but it's a testament to everybody involved that despite all the challenges that the pandemic threw our way, that we persevered and stood up. CoverME.gov this year. We again remind people that coverage couldn't be more important than it is now. That's part of the reason why we forged forth to do it. And we hope that we really re-engage the consumers. There are about 59,000 people in Maine who are in Healthcare.gov. We're hoping that all of them are re-enrolled through CoverME.gov. Plus, we hope we get more people coming in who are new consumers so that we can continue to meet our basic goal, which is to make sure all people in Maine have access to affordable coverage.
Susan is also wondering in the chat, I guess she's saying there was a glitch having to do with estimated household income for 2022, and she's wondering if that glitch has been fixed. Is that something you're familiar with, Commissioner?
Yep, it's called the family glitch. Is a concern that has been around since the Affordable Care Act was passed in 2010. It is something I know Kate can speak to as well. We know that the Biden administration is concerned about it as well. We're hoping that there might be federal action that could address this issue, that it's easier for an individual who lacks affordable coverage to get financial assistance than it is for a family member, which is the bottom line of what the family glitch is. It is a problem, and we're hoping that the federal government fixes it.
Okay, thank you. Kate, would you like to add anything to that?
I think that's a pretty good overview. Essentially, it's earlier Patty mentioned, when are you able to get subsidies on the marketplace if you have an offer of employer coverage, and she said that, if it costs more than 9.61% of your household income, and essentially does it cost more than 9.61 of your household income to cover the employee only? So they don't take into consideration how much does it cost to actually include that spouse or those dependents in that employer plan. And so because of that, because they're not taking that into consideration, the employer coverage for the whole family could be quite unaffordable. And unfortunately right now, that offer of coverage would still, keep them out of qualifying for marketplace assistance. But as Commissioner Lambrew said, this is a known issue that a lot of people and groups have been, really working on, trying to find a solution to fix it and to expand access to affordable coverage. And with that said, there's unlike, marketplace subsidies, if you have an offer of employer coverage, that does not impact your ability to qualify for Maine Care. And so there's a lot of people who may also be able to access affordable coverage through Maine Care as well.
Can you talk a bit about how this new system will interact and is interacting with Maine Care and Medicare?
So with CoverME.gov, marketplace plans in general, really for most people that have Medicare, isn't going to impact them at all. Unless somebody has to pay a premium for their Medicare Part A, which is not too many people, then people with Medicare actually can't purchase their coverage through CoverME.gov. However, with Maine Care or Medicaid, if somebody applies for marketplace coverage and it turns out based on their income, it looks like some or all of the people in that household are eligible for Maine Care, that information would then be sent to the Maine Care office at DHHS, and they would start beginning processing that application there. And so it a no wrong door approach. If you apply for Maine Care and it turns out your income is over, you should receive information about the marketplace coverage. And if you apply for a marketplace and your information based on your income looks like you're going to qualify for Maine Care, you should also get directed into that as well.
Thank you, Kate. Does anybody else want to jump in on that question of how CoverMe is interacting with Maine Care and Medicare?
No, Kate said that well, thank you.
Okay. Another question that I'm going to lob first at Kate, but again, if anybody wants to jump in, someone in our survey was asking about Medicare Advantage, and their question was, what do I sacrifice by switching to a Medicare Advantage plan? So maybe that question, but more generally, how does Medicare Advantage factor in here, if at all?
So I'll say I'm personally not a Medicare expert, and when I get Medicare questions, I refer them to the Medicare experts, and would encourage people to contact their local area agency on aging, which are the SHIP counselors in Maine, and they provide free assistance to help people navigate their Medicare choices, and are available throughout the state as well. Okay, I see someone else in the chat is wondering if you have Medicaid or Maine Care, do they take your house when you die? I think that might depend on the situation, but anybody want to answer that one with any sort of definitiveness? Sure. And certainly others should feel free to jump in. I think what they're referring to is something called a state recovery. And so there's a federal requirement that for people above 55, that after somebody with Medicaid passes away, that the amount that was paid out in services is, recouped from their estate. However, there are, several exceptions to this. And, for starters, if they have minor children, if they have a living spouse, all of those recovery efforts would be delayed. But I think really importantly, in Maine, just this past year, the legislature and governor included a big change that's going to change it. So as of right now, it's only going to apply mostly for long-term care, nursing home. And so for, most services, it's not applicable anymore. And so that's a change as of, I believe, this July. Okay, thank you for that clarity, Kate. Another question, again, it came in through the survey, and to everybody listening along, we've got about 4 minutes left. So if you have any more questions, this is last call. But another one from the survey, which I think Patty probably is most easily directed your way. People wondering, can individuals apply through CoverMe regardless of their marital status?
The quick answer is yes. So you can be, if you are married at the end of 2022, you will file a joint tax return. There are exceptions to those as well. And that would be like an injured spouse or a separation due to domestic violence. And if you're single, you can apply. If you have one spouse on Medicare and one spouse that does not have employee-sponsored health insurance, they can apply through CoverME.gov. So yes, regardless of your marital status, you can apply. And I did want to add one thing. So based on what someone said that they had found, Jane said that she had found that once you go into the health insurance and you've completed your application, submitted it, and then you're going in to review plans, it does show on the left-hand side. One of the questions is network, and it would be nationwide or Maine regional. And so you can click a box if you want national coverage. Let's say you're a snowbird, and so you want coverage in both states that you're in. There is that option. It is on the platform, on the application platform, but I did not see it into the estimator, the comparison tool.
Thanks, Patty. Can I add
Thank
one
you.
thing too that I want to make sure that people know, which is, you know, we talk about this issue of affordability. We estimate that 70% of people coming to CoverME.gov can find a plan for less than $50 a month. So we do encourage people to come. And while COVID-19 treatment may be very expensive, as a reminder, the COVID-19 vaccine is free.
That seems like a great note to end on, Commissioner. Thank you. Thank you to all of our panelists tonight and to all of you for being here and sharing your thoughtful questions. I'd like to remind everyone that you can send letters expressing your views and aha moments on healthcare or other issues not related to this event to the Bangor Daily News at the email address letters@bangordailynews.com. There's also a form on our website. Either one works. Our lovely opinion editors have reminded me that we can't always accept all letters that we receive. That's the caveat, but they are happy to work with you to share your perspectives. Thank you for that. And a final note, please keep an eye on your email inbox over the next couple of days for an event recap email. We'll try to grab any references that were mentioned in the chat or throughout the conversation and drop them in there so you have a handy reference guide. That will include a link to the video of this evening's discussion. Also, there's a document that I think Patty sent our way today that we wanted to send out to you guys, just some information about how to navigate, so you have that as a reference, and a promo code that you can use for a discounted BDN subscription if you don't have one already. So thank you again, everyone. Have a great and safe Thanksgiving holiday, and have a lovely, dry evening. Bye.